Hello again. I'm guessing that many viewers will have seen the case of the Iranian who has been working as a psychiatrist in Britain for the last 20 years or so. She claimed to have qualified in New Zealand and somehow her bogus qualifications were not checked properly. She's now been convicted of what the judge described as a wicked deception, and she's facing a substantial prison term. We can see her in the thumbnail to this video, and I give a link to a news item about the case in the description to this video. It is to be feared that she is far from being an isolated case. It is often claimed that Britain's National Health Service depends upon foreigners and that this tradition began back in the 1950s. This is a debatable point because even in the 1960s, most hospitals in this country were staffed only by white British people. But let's look at the situation today. I give a link to the government's figures, which claim that 80% of NHS staff are white and only 20% from visible minorities. This will surprise those who have had dealings with hospitals lately and find that it is hard to track down a white British doctor or nurse there. The explanation is, of course, that there are only a limited number of categories for ethnicity, and the way that the data are collected means that white includes Egyptians, Iraqis, Iranians, Romanians, Moroccans, and every other nation on earth whose citizens are not actually black Chinese or from the Indian subcontinent. If instead of white, which is used as a catch-all category, one were to ask how many actual white British-born doctors and nurses are to be found, then the answer would be a good deal fewer than the nominal 80%. Does this matter, though? Well, it does seem to. Doctors and nurses from overseas and those belonging to ethnic minorities are many times more likely to have complaints made against them, which are upheld, than are those of white British origin. I suppose part of this might be attributable to racism, but I mean, we're talking here about 7 or 8 times the level for white British people, medical staff. So I think there's probably more to it than simple racism. Why should this be? What's the problem? Well, for one thing, there is often a language problem. That is to say that patients cannot make themselves understood, nor can they understand what the doctor and nurses are saying to them. The difficulty here is that to practice medicine in this country, doctors and nurses have to pass a language test, which is heavily geared towards medicine, for obvious reasons. But of course, patients don't know this. Patients aren't doctors. So you may well have reasonably good language skills that enable you to talk about medical matters. But most patients that come into hospitals that present at the A&E aren't going to speak in medical terms. They're going to use ordinary demotic English. And that's not tested for when foreign doctors are given permission to practice in this country. Obviously, I'm not talking about every single doctor or nurse, but rather about a general trend. This can lead to misunderstandings and medical mishaps. The greatest danger, though, is the difficulty of checking properly the references and qualifications for overseas medical staff. The case of the Iranian who came from New Zealand and posed as somebody with a medical degree for 20 years in this country is a classic example of the problem. If I tried to get a job in this country as a doctor or nurse, it would be simple enough for the health authority to check where I had supposedly trained or attended medical school. They could run a DBS check, take up my references and so on. It wouldn't be hard for them to find out if I were lying about being a doctor. It's not always so easy if somebody claims to have attended university in an obscure town in Ukraine, Egypt or Ghana. Even finding somebody at such places, if you've got through on the telephone whose English is fluent enough to have a fruitful exchange, can be tricky. And so a lot of the time one is compelled to fall back on paper certificates. This is obviously hazardous. Also in the description to this video, I give a link to the United States Justice Department a month ago. they began prosecuting people involved or allegedly involved in a huge fraud involving the selling of nursing qualifications. This meant that those who buy such things were able to practice in America as nurses and then go abroad to any other country and start working in hospitals as nurses without having studied nursing at all. This racket is well known all over the world, and it's a popular way of entering this country to get work. Buying a certificate which says that one is a doctor or nurse is simple enough, and then coming to live in Britain follows on easily. I might mention that the same thing happens with pharmacists, and I was told today of a very good instance of this. In some parts of the country, they're so desperate for dentists and doctors that they're very keen to take anybody who applies without investigating their credentials too closely.